Good evening. Thank you for inviting me. It's good to be back here again to do research on TAP. I like these talks because they're 5-minute talks, and I don't have to make a lot of slides, so it's perfect. In the previous research on TAP, I was talking about neuroscience because that's kind of really a large part of our lab's research. But I think we also spend a great deal of time on looking at digital pathology, and I think I didn't get a chance to sort of really talk about my team. I think today I took this opportunity to actually put one of my first slides as my team slide, because there's something I really want you to notice here, because we've been very fortunate. We've been very fortunate to have students and trainees and postdocs coming from different disciplines who are trying to team together to work on something interesting, right? So we don't necessarily focus on methods. We also focus on actually solving a problem, but hopefully also innovate on the methods as well. So we have students from computer science, neurosciences, MD students who are going to be future doctors, and we put all of those people in one room. Sometimes magic happens. So we're very grateful. And I think with that, I just want to quickly talk about digital pathology, which I think is an interesting field. So if you look at, again, if you go to a hospital, there are many departments. There is a department of medicine, there's a department of surgery, pediatrics, you name it. And there is also something called as Department of Pathology, right? So a pathologist never sees a patient. Everybody knows this, right? So pathologist actually is a back-end doctor, also MD trained, but they basically deal on a daily basis looking at microscopic samples under the microscope, right? So over the last century or so, the practice of pathology has remained the same, right? So the sample gets from the patient, it goes to the pathologist, and the pathologist sort of does a lot of processing on that, and then finally looks at the sample under the microscope, and then makes a report. And that report basically goes back to the attending physician to see the patient, right? So there is this practice of pathology which has been the same for many, many years, but interestingly enough, more recently, because of the fact that we can potentially use a scanner to digitize that specific sample, we are about to create a large amount of data, which potentially has phenomenal opportunity for data scientists to sort of look at the data itself, right? So here what I'm showing is this routine procedure where a biopsy is done on a patient, and that's how the sample looks like. And then once the sample gets processed using what they call as histological processing, and finally, if you have a digitized image, then you're talking about machine learning there. You're talking about computer vision. We're talking about multimodal data learning from these kinds of samples. And unique to these microscope images is the fact that these images are really huge in size, right? So a microscope image, one image, is probably a gigabyte of size. That's huge, right? So traditional computer vision models that are coming from the traditional CS world may or may not work right away. So we have to think about innovation on that front. Right? So I think that's what we are really focused on. And I want to just give you one example, right? So again, there is a revolution also happening in therapies, right? 20 years ago, if somebody had cancer, it was almost like a death sentence, but now there is hope. There is hope for some patients to actually get targeted therapies, specific therapies where there is potentially a cure for cancer, right? So how do people actually come up with those therapies? They look at different kinds of mutations, and then finally, the drug is approved by the FDA. The oncologist sees the patient and then basically gets a sample from the patient and then sends the sample to two different places. One is going to the pathologist, one is going to what they call as genetic testing, right? So what happens in genetic testing is that they do a lot of sequencing on that sample, and then they identify all these different kinds of mutations that are present in those samples. And then finally they decide, okay, if this specific mutation exists, there might be an FDA approved therapy for that specific mutation, right? So there is a lot of stuff going on in terms of identifying the right patients who are amenable to cancer therapies, right? So this is what we're interested in. I haven't talked about machine learning yet. So one slide quickly. So what we do is we kind of think about this whole data set as a sort of this novel data set where you have 1 gigabyte of data. Traditional computer vision may or may not work. So we are thinking about these representation learning approaches to sort of really fuse information from many different regions within those whole slide images. This is a paper collaboration with Dr. Margaret Betke, who's here, where our PhD student Yi came up with this approach to sort of really transform that whole slide image into a graph, which was then fused with this something called as a vision transformer, sort of assess the pathology on those whole slide images. And then it's actually also an interpretable machine learning technique where we can also go back to those images and see which regions of interest are actually affecting the outcome, right? So this is very exciting. So if anybody's interested, we'll talk more. Thank you.